Hi there, I'm Andie Summers from 92.5 XTU Philadelphia's Country Station, and welcome to Ask the Doctor. Joining me today is Dr. Joseph Lombardi, Division Head Vascular Surgeon at Cooper University Healthcare, and Dr. Lombardi is going to answer some of the questions that you've submitted on our website. So we have gone through so many great questions that you've asked on our website about aortic aneurysm. So if you wouldn't mind answering some of those.
Sure.
Because you know more about it than I do. So let's get started with the basic. What is an aortic aneurysm?
An aortic aneurysm is a degenerative defect in the wall of your aorta. If you look at your arteries as highways and streets of delivering blood flow to your tissues, the aorta represents the major highway through which all the blood flow is distributed in your body. So the weakness occurs in the wall due to atherosclerosis, and then ultimately the wall starts getting bigger and bigger and bigger and weaker and weaker and weaker and thinner, and ultimately the risk is rupture. So that's what an aortic aneurysm is, and it's largely due to atherosclerosis.
Okay, so does high cholesterol contribute to that at all?
Absolutely.
Yeah.
So one of the processes of atherosclerotic formation or plaque formation is deposition of cholesterol crystals on the wall of your arteries. So cholesterol plays a big role, and patients with elevated cholesterol would be considered at increased risk for atherosclerosis and aneurysms, peripheral vascular disease, and that sort of thing.
When I hear the word aneurysm, I have this horrible image that it's like this ticking time bomb and you don't really know what's going to happen with it until it's too late. Is that a fair assessment, or am I totally off on that?
It kind of is, although I think most people would worry about it a little more than they should. For instance, small aneurysms are not at risk, serious risk for rupture, and the risk of performing surgery on those patients is actually higher than waiting. So when the aneurysm gets to a certain size, then you really do have a ticking time bomb, and the risk of surgery is actually less than the risk of waiting, and that's where we make the judgment call.
Okay, so what are some of the symptoms that we can look out for? Is this something that I'm going to notice I have in my body?
Most aneurysms are asymptomatic, meaning there are no symptoms. But some people are fortunate to get symptoms because it prompts them to get some medical attention. And some of those symptoms can be belly pain in your abdomen. It can be back pain. And there are also some weird presentations too, where patients have a nerve that's pressed on by the aneurysm causing leg pain or whatnot. So there are a variety of different kind of atypical presentations for patients, but for the most part, abdominal and back pain are the biggest indicators.
Okay.
Now, just because you have abdominal pain doesn't mean you have an aneurysm.
I know, I'm thinking that happens once a month for
So
me.
you got to balance that with seeing your family doctor, getting a good physical examination, and getting a good history, determine whether or not you have family members with aneurysms and whatnot, and that can clue a primary care doctor into hunting that down further.
Okay, I look at some of my family members, mostly the men in my family, who don't like the doctor, so they don't go. What happens if you have an aortic aneurysm and it goes untreated?
Yeah, some people are very fortunate where the aneurysm gets very big, and all of a sudden they'll say, hey, you know, I have this big pulsation in my abdomen, and I don't know what that is, and it prompts them to go see somebody. But it can be a health risk, particularly, again, if you have a family history of patients with aneurysms.
Okay.
So it can be a health threat. There are over 15,000 patients last year who have died from a ruptured aneurysm. So clearly, we're not meeting the need of diagnosing this in a prompt fashion.
Right. Okay. Joyce has a great question here. What is the difference between an aortic aneurysm and an aortic dissection, and are they treated differently? I say that's a great question because I don't even know what an aortic dissection is.
It is a great question. So a lot of times there'll be a misnomer. People say, oh, you have a dissecting aneurysm or whatnot. But an aneurysm is more or less a weakening in the entire wall of the aorta. A dissection is your aorta is made up of 3 layers. And it's a tear on the inner layer causing blood to track down and blister through the wall of the aorta. So think about that. Yeah, it hurts like hell. So when that happens, people are in excruciating pain.
Okay.
And they go right to an emergency room. Something's horribly wrong, and they know it.
Right. Okay.
So a dissection is more of a tear in the wall of the aorta. That can result in an aneurysm from a weakening process. It can happen very quickly, or it can happen over time. but usually the dissection process is sudden, instant, prompts you to go right to the emergency room.
So let's say I don't know if I have a family history. I'm not experiencing any symptoms that you had mentioned, any pain anywhere, any unusual symptoms.
Right.
Is there a screening process? Is there something I should be doing to get checked out to see if I have one?
Absolutely. So if you're over the age of 65 and you're a smoker, you should get your family doctor to order you an ultrasound of your abdomen just to check to see. Those are the patients that have the highest risk.
Okay.
So it's an age factor and it's also a lifestyle factor.
Right.
65 and smoking.
Okay.
And if you have a family history,
Right.
you could lower that number at least at the age of 60 to get a screening ultrasound. For instance, if your father or your mother had an aneurysm, then you would have a higher risk of getting an aneurysm from 15 to 20%.
Okay.
Yep.
Okay, good news. So Paul wants to know if his grandfather had an AAA, an aortic aneurysm. Where does the third A come in?
Where's
Maybe
the
he just means an AA, an aortic.
triple A?
A triple, is that what it's
abdominal aortic aneurysm.
called? Abdominal,
Yeah,
got it,
triple A,
okay.
yeah.
Then is he more likely to have one, and can he prevent it?
Yes, he's more likely to have it, and yes, he can prevent it. For instance, if he has high blood pressure, controlling that blood pressure can result in progression of an aneurysm from its growth process. So if he has an aneurysm
Right.
and he has high blood pressure, controlling that blood pressure will decrease the rate of growth of that aneurysm.
Okay, so just really take good care of yourself and go to the doctor.
Absolutely, and exercise.
Go see great
And stop
doctors like
smoking.
Dr. Lombardi. Right. There's a lot of things we
Right.
should be doing that
Yeah.
can help prevent that. Okay. Is there a certain diet that someone should follow?
Low fat, high protein, all the same things you hear
Right.
every day.
That even if you don't have one, you should probably be doing something like that anyway,
Yeah.
right? Yeah. Okay. Okay. Another question. This one from Brittany. Once I have a AAA, I'm using the lingo now. Once I have a AAA, do I have to see a specialist, or can just my general physician treat me?
It will be up to your general practitioner to determine when he wants to pass the baton on to the specialist.
Right.
So for instance, all patients who get a diagnosis of aneurysm, most of my primary care doctors want me to manage that and worry about that because they've got a lot to worry about as it is. And so it's usually a team effort. They're controlling their blood pressure. I'm making sure the aneurysm is not too big, and we interact and communicate that way. So usually that's a really good strategy.
Are there any new treatments that are, in the process of being worked out? Or,
Plenty.
yeah.
One of the most beautiful things about what I do is there's always new toys to fix aneurysms. And at Coop, we have a lot of clinical trials to bring on new technology, kind of a more minimally invasive trend going for all types of procedures, not just with aneurysms. So we have devices that are smaller, that can go through the skin, don't require incisions, get patients home the next day,
Nice.
and have equal outcomes to what's available today.
That's
So,
great. Those
so
are
yeah, so
a
that's
lot
good.
of keywords. I liked minimally invasive, small, and you call them toys.
Toys.
So that's very fun. So it's like a fun thing to have a AAA. Not so much. Avoid them
Probably
if you
not.
can.
It's fun to fix them.
Yeah, well, there you go.
Probably not fun to have. Yeah.
Okay. And finally, what makes the Cooper Vascular and Endovascular Surgery programs unlike anywhere else in the Philadelphia area?
Oh, good question. Well, we have a lot of facets to the program. One is we have some really good surgeons that provide great care.
Like yourself?
Well, thank you. But not just me, but we have a team of very able surgeons that can treat all of these disease processes, namely aortic aneurysms. The Aortic Center here at Cooper is a strong program where we're transferring patients from all over the Delaware Valley and most of South Jersey to Cooper for aortic emergencies. So you can have an aortic emergency in Atlantic City and be at Cooper within a half hour from our transportation service. So that's a distinction as well. We've got a training program. So we're teaching future vascular surgeons how to do this stuff in addition to the clinical trials, bringing on new technologies that you're not going to see available here for many, many years to the general public. So you'll have those advances in technology available here and right now.
Fantastic. We're glad to have you right in our backyard then.
Well, thanks.
Thank you
Glad
so
to be
much. Thanks so much for your time today. And if you have any more questions or you want to learn any more about this, you just can visit our website at cbsphilly.com/CooperDocs.
Thank you.